Good afternoon. Welcome to the I was about to say the Human Service Coalition, but it's not. It's Health and Human Services committee meeting. It is 1 o'clock, Monday, August 26th. We are calling the meeting to order. Is there any changes to the agenda? I do have a resolution to add at the end of our meeting. Is there anybody here for public comment? No? All right. I do not have a chair's report this week. I will save it for our esteemed colleague, Shauna Black, when she gets back. I'm sure she'll have a lot to share with us. We'll jump right into the county administrator's report.
Thanks, Travis. I have a brief update and then a resolution for consideration. The update is about the Office of Cannabis Management and local enforcement powers. We discussed this at the last Public Safety Committee meeting and said that we would also be bringing it to Health and Human Services just as an update. So in the 2024 budget, the governor granted additional cannabis enforcement powers to municipalities, whereby municipalities like the county could pass a local law consistent with the enforcement powers on the state level around illegal cannabis sales, and we could do our own local enforcement. There was a conference call back in June and several county staffers attended. And then since then, Bridget Nugent from County Administration pulled together a staff from several departments, including a county attorney, sheriff, DA, and whole health to discuss what adopting a local law would look like in Tompkins County and what resources would be needed. And I'll just give you the same update that Bridget provided the Public Safety Committee. Currently, how local illegal cannabis sale enforcement is working is that any complaints about illegal cannabis sales received by Tompkins County Environmental Health or the Sheriff's Office or other community partners like the city, they're directing those complaints directly to the New York State Office of Cannabis Management. And then from there, very little information is passed down or received back from the state. So no one at the local level, including the DA, the Sheriff's Office, or whole health is notified by OCM when an inspection or an enforcement action is taken within the county. So we're not aware that we're not aware of criminal charges being leveled, and the DA is not kept updated on any criminal or civil proceedings. And then there has also not been much noticeable follow through in terms of closed shops. At the same time, our environmental health team has noted that there is a high level of concern for safety that exists for environmental health inspectors going into businesses that are selling vaping products to minors. And those establishments that allegedly sell cannabis products are very often selling vaping products as well. And that security concern has resulted in a pause in these types of inspections, and New York State has allowed for a pause to take place because they too are aware of the safety concerns that exist for environmental health inspections. So in discussions about considering adopting a local law to expand the authority to enforce on the local level, all have been pretty much in agreement that if we were to do that, our efforts should be focused around the illicit sale of cannabis to minors. That is the main concern, and any type of enforcement would require an investigation with a controlled purchase. There's also discussion that this should be in partnership with the city and other local municipalities, law enforcement, where the cannabis shops are, the illegal cannabis sales are located. Around partnership around the enforcement, and that there will be additional resources needed to ensure effective enforcement of the local law, which may include increased staffing at the sheriff's office. All cases would be pursued civilly and require additional staff time on the county attorney's office as well. And we'd also be looking for a clear understanding of what the expectations are for enforcement, as many establishments are able to close for a few days and then reopen under the same, in the same location, but under a different name. So close coordination would need to take place with OCM on who will be handling enforcement for each investigation, and more regular updates on proceedings. So this is just the update to make you aware that staff is looking into this. At the Public Safety Committee, there was a desire for staff to look into local law and the cost of enforcement, and we just are continuing to discuss the best path forward and the resources that would be needed.
Questions for Lisa? Randy?
Yeah, thank you, Lisa. What a surprise that the New York State's struggling with this. So the safety concern, is that threat of violence, is that the concern of this?
Yes.
Okay. And the other thing, I was contacted by Town Newfield, and they have somebody in the Town Newfield making gummies. And so they ask, gummies out of marijuana. So they asked me, well, who are the licensed people who are approved to grow and manufacture these things? So I checked with a few people at the county, and I'm not sure if they even know that information. If we know who's been authorized to sell and who's been authorized to grow. Apparently there's at least 2 places in Newfield that are growing marijuana. So they're getting complaints from neighbors, and so my question is, who knows who is licensed to do this stuff?
So I can say that our finance department receives notification when a new shop that's licensed opens in the county because of the sales tax that we're collecting, and then the county receives a portion and distributes a portion to the municipality where the shop is located. So that's one way that we are kept informed. I'm not certain whether the whole health department receives any other type of notification, but that's the one piece that I'm aware of.
Thank you.
Yeah, thanks, Lisa, and I'm glad the folks at Public Safety are talking about this. So just for clarification, so the pause on enforcement is for folks going into like the illegal shops, not because the dispensaries are all approved and everything.
That's correct, and the pause on enforcement is around the sale of vaping products to minors.
Right, so I guess, so some of these shops are selling the vaping products and cannabis, okay.
That's correct, yep.
Okay.
I think the pause is with respect to tobacco enforcement.
Okay. Okay. And then just also to clarify, you said that the sheriff's office said that if we did have a local law, they would want more staff, or was...
Again, Maury's been in these conversations, I have not, but my understanding from Bridget and Maury is that additional staffing resources would be needed. I'm not sure to what extent we're talking. And we would also be looking at partnering, if there are municipal law enforcement agencies where these shops are located, we would want to be partnering with them.
Okay, thank you.
Lisa, I know you weren't involved in all the meetings, but in the response to Randy, you mentioned taxes. And so the registered cannabis shops, they pay taxes.
That's right.
But if we have 3 or 4 of those, I don't know what we're up to now, but if we have 2, 3, 4 of those, they pay the county, and then money goes to the municipality for taxes. But if there's 6, 7, 8 illegal shops, whether they're selling to minors or not, they're not paying taxes. They're selling to minors. They're basically operating rogue and illegally, which hurts the folks that are doing it the right way. So, but the conversation is limited to, so far, to cannabis shops that are also selling to minors and not cannabis, illegal shops, period?
No, I'm sorry if I confused. It's the illegal shops. We're not, this discussion isn't about the legal dispensaries. It's about the shops that are selling illegally.
2 kids or just illegally, period?
Illegally, period, but I think the conversation among the law enforcement personnel was that in terms of looking at illegal substances, cannabis ranks fairly low on the priority scale. However, talking about illegal cannabis sales to minors ratchets it up a notch.
Understood. Thank you.
I've got one more question.
Go ahead, Randy.
Lisa, I remember who came to one of our meetings, but they mentioned about tainted marijuana. Is there a place where people can have their marijuana tested without persecution, or, I mean, is there any way they can, how would you know?
This is maybe more of a public health question. I'm not sure if fentanyl test strips are effective around marijuana. Again, using the licensed dispensaries where the products are from known sources and can be verified and tested is the best bet, I think.
Thank you.
Did you have more?
The only other thing that I had was a resolution for the committee's consideration.
We do a second after the move? Yeah. Or do we have a second? Susan? So Amanda moved it.
Okay. Sure. So I can talk to where this resolution came from. I also see Kit and Frank on the call, so please feel free to jump in. The origin of this resolution is we had a couple of formal conversations with the hospital, Cayuga Medical Center, and I know the whole health department as well as the Department of Social Services has been involved. Their staff have been involved along with the hospital staff for, in some cases, weeks and months with concerns around patients who are part of the OPWDD system, people with developmental disabilities who have limited or no options locally for housing, for placement. The erosion of services across the state have impacted our municipality, so that we have had cases where individuals literally have nowhere to go and have spent weeks and sometimes months being cared for in the hospital. They are otherwise eligible to be discharged from the health perspective, but there is no place to discharge them to. So in these conversations where we were talking about, the specific instances and what could be done to assist these individuals and what we could do working together, one of the items on the list of follow-up was to make our legislators aware on the county level and on the state level that the lack of and further withdrawal of services from OPWDD around supportive housing is having an impact locally, and to make it known.
Conversation, Randy?
Thank you, Lisa. We had a couple constituents come and bring this issue up to us, and I sent an email out that I visited the 5 locations in Tompkins County, and the one that's still operational is on Lincoln Street, but they're decommissioning that one as well, or whatever the term they use is. And I visited the other 4 facilities, and they're all empty, and they're all in good condition, and looks like they're being maintained. In that process, I left my card with somebody, and I was contacted by a gentleman from OPWDD, which I copied you on that. So anytime I've conversed with them, I make sure I copy you on that. I haven't responded to his last email because I wanted to talk to you about it first. So, and the issue came up is, well, what, I asked him what he's going to do with these houses that have 40 bedrooms total. They're big outfits, right? And they didn't know. And so he asked if there was any ideas, and so I stopped there. I didn't move forward with any ideas. But it's a shame that they're sitting empty in the facility. One of them right down on Aurora Street, a nice big building. Could be all sorts of things for somebody. Another state facility that's been closed and just mothballed. They're all over the place. So thanks.
Anyone else? Shall we vote? All right, all those in favor? Looks like that carries. Thank you, Lisa.
Thank you.
All right, moving to the Department of Social Services. We have a resolution, ID 12568. I think Kit is still here. Kit, would you like to talk about that?
Sure. Hang on just a minute. I've got a 1258.
12568.
568. Sorry, this is the X-ray one. Just want to make sure I'm talking about the right one. Yeah, so we've actually run this through a committee before, but it's back to be reviewed. This is, we had done an RFP for X-ray machine. We've clarified on here really that the funding, we will get some funding through reimbursement. And then some money will come from the contingent fund. There is an extended warranty that we are looking to purchase because it covers a number of very specific things that are required or necessary when you buy an X-ray machine, which is something when we did the RFP initially we didn't realize would be a part of this, but there are 8 annual radiation safety inspections. There are parts travel by the technician that's covered, all sorts of other mechanical things that if they go wrong are covered by the extended warranty. So I think in the long run, it is a much better deal to be buying the extended warranty than not to have that and have to pay for those things separately. So that's where this is at. We're looking for, we're requesting approval so that we can add this to our security detail for the Human Services building.
Thank you. Do we have a mover? Do we have a second? All right. Moved by Amanda, seconded by Randy. Questions? Shall we vote? All those in favor of, okay. Kit, while you're here, there is another resolution, 12694.
Yes.
Would you like to talk about that?
Sure. So, so this is actually, this is an adjustment to our STEP funding. STEP, as people probably remember, is the Solutions to End Homelessness program. We get this money from OTDA through the state. And we have gotten through a directive that they have approved rollover of unexpended STEP money from 2023 in the amount of $107,503.51. So we're looking to add this to our funding to provide for STEP. We'll need to expend this fairly quickly, but we are. Every place that we can, we're using a housing first approach, and this will really help us to supplement the funds that we currently have through this program. It's been a really very successful program with somewhere in the 80 to 85% success rate of people being housed still at the 6-month mark after utilizing these funds. So we're pleased to have the approval for rollover. So we're just asking for approval for this.
All right, do we have a mover? Susan. And Amanda seconds. Discussion? All right, shall we vote? All those in favor? And Kit, while you're still on screen, would you like to give any updates?
I don't have significant updates right at the moment. I will say that we are working, as people know, we've had an RFP out for shelter services. We're working on that process right now. We are awaiting our Code Blue allocation. Still haven't received that, but hoping that that will come in shortly, and that's going to inform our process with that program. We are hopeful to also get our HEAP allocations soon. We've been seeing HEAP run almost throughout the year in the last 2 years because we've had some cooling money, but we're in that place right now where we're waiting for the fall allocation to come through. I think that's probably all that I have right at the moment for an update.
Thank you, Kit. Does anyone have any questions for Kit? All right, thank you, Kit. We'll move on to Office of the Aging. We have several resolutions for Office of the Aging. Lisa's here. We'll start with ID 12676.
Okay, great, thank you. How's everybody doing?
Well,
Good. Yeah, so this is just a budget transfer, basically. We had we're attempting to increase the hours of our ombudsman staff from 35 to 37, and the increase in the funding is discussed in the next resolution.
all right, do we have a mover? Randy moves. Amanda seconds. Any questions? No? All right, let's take a vote. This passes, and so we'll go to ID 12677.
Great. Yeah, so our normal budget for this had an increase in it of the $49,184. Also, we had received over, about $104,000 from the grant as well, which was called the Advocacy and Enhancement Grant. That is where it's designed really to expand services and increase the visitation in facilities. So part of how we're doing that is increasing staff hours so they can get out there and do that.
All right, do we have a mover? Susan moves. Amanda seconds. Do we have any questions? Let's take a vote. This passes unanimous. All right, you got one more, Lisa.
Yep.
ID 12613.
Yeah, and this is just approval of our amended bylaws. It's really just aligning with the administrative policy that came into effect this year. So we, made a few changes. It was approved by my board, and now it's up for your approval.
All right, do we have a mover? Amanda moves. Randy seconds. Amanda?
Yeah, thanks, Lisa. I was reading through this. This looks great. We appreciate you getting aligned with the county policy about bylaws. I meant to ask this morning, we had our COFA advisory board this morning. Is there a vice chair?
There will be.
Okay.
There's not currently. Yeah, we did not have a lot of, through COVID, that we missed a lot of meetings, and there wasn't a true vice chair elected last year. So that period of time, this will start to happen. We'll put the ballots out probably in late September, October, and vote in the November meeting for a new chair, vice chair.
And that's great. And then I don't see in here that there's term limits for a chair.
There's
so,
not.
Yeah.
That is actually probably the most significant change that was made. Otherwise, it was just putting it in the right format and grammatical things. But that did change. It's very hard for us to already get people that are willing to be on the board. So if people are still willing, we thought that would be wise just to get rid of that, and at least that someone would be on our board to be able to make some of these decisions.
Yeah, okay. Great. Well, thanks again for getting that done.
You're welcome. Thank you.
Any other questions? All right, shall we vote? That passes. Lisa, while you're here, would you like to give a update?
Don't really have much. We do still have some farmers market coupons left. So if there's older adults in the area that have not gotten a booklet and that are eligible for that, send them our way. We will go out to people's houses. We'll go to any kind of events. We've been to several, but I don't like returning them to the state when we have over 200 left this year. So I'd really love to get those distributed. And then our next big things are, as Kit mentioned, HEAP season coming up, and our health insurance counseling open enrollment in the fall. So other than that, we're just plugging along.
All right, thank you. Any questions for Lisa? Susan?
For the farmers market coupons, if I send out a note to my district, they can just come to contact the County Office of the Aging for how to
Yep.
get? Okay.
Yeah, anybody can call us. We'll figure out how to get it to them.
Okay, thank you.
Yep.
All right, any other questions? Thank you, Lisa.
Thank you.
Next up, Veteran Services, J.R. Claiborne. J.R., we have a resolution from your department, 12638. Would you like to talk about it?
Oh, sure, yes. Wait a minute. Thank you. Thanks, everybody. Hello, good afternoon. Excuse my voice if it goes in and out. This basically is putting back something that we had when we're trying to staff up. In short, it's a budget neutral move, and it just converts the, it converts the former VSO position that was changed to allow me to hire a project assistant. It's putting it back on the books.
Okay, do we have a mover? Susan moves. Amanda seconds. Questions? Amanda?
I guess I don't, maybe you could try explaining again. I don't fully get it. It's not a new position?
Correct. Basically, when I was able to hire a project assistant, because I did not have that on my roster, HR had me convert the VSO position into the project assistant. And so now this is putting it back in preparation for being to hire, excuse me, being able to hire a veteran service officer.
And is the salary and fringe is the same, or I guess I don't understand how you can do that.
No, this puts it back to what it was. Excuse me.
Okay.
Sorry about that. So no, the project assistant was definitely much lesser pay for this, but it allowed me to be able to hire that position. And so this this move will restore that position back to my roster.
Okay.
Lisa?
I can try to take a stab. I think so the Veteran Services Officer position has been part of the budget for Veteran Services. There was a period of time where JR had staff on leave, and he was looking to get some temporary help, and he didn't have a position available. So with the help of HR, they created information aid or project assistant position, but to do so, they had to use the only other existing vacant position, which was Veteran Services Officer. Now that he's wanting to go back and hire a Veteran Services Officer, we have to recreate it. So it's not adding new, it's just kind of putting it back.
I'm sorry, go ahead.
Okay.
So it's budget neutral because the position paid more. The new position that was created, or the temporary one, paid less. So we're just changing the title back to the pot of money that already exists. So that's why it's budget neutral.
That's right.
Got it. Other questions? All We're ready to vote? Wait, we did motion. Yes, are we ready to vote? All those in favor, raise your hand. All right. JR, while you're here, would you like to share, give a report?
Sure, I will. This summer's been kind of fun because we've, Warrior Riders Tompkins, I'm taking ownership of them. They were already existing before when I got them. But they've met this summer. They usually take a break for the summer, but this year we've hosted them all the way through. Also this summer, the VA Veterans Advisory Council, it's a bi-monthly meeting. I host that, and we've continued to do that. More exciting for me is I've talked about our Women Veterans Group, which we just started at the end of March. They had their first outing this past week where the ladies decided that they wanted to do something, and they had a walk. They all got together at Stewart Park and walked over to the farmer's market. And there, Michelle and I met them, and we issued Fresh Connect checks, which are similar to farmer's market checks for those who didn't have them already. And so they got them pretty excited, and hopefully that'll spur some more growth of the group. And then lastly, just an outreach level, I attended the Cornell Veterans Resources Fair this past Friday. I was able to do some outreach with students up there, student veterans, as well as I've got a couple of things in the works that will be planned for later in the fall. And similar to what Kofa just said, my department still has Fresh Connect checks, which we don't have as many as Kofa, but they are first come, first serve, and that is available for veterans and their immediate families.
Great. I heard that you were moving.
Yes, the bigger news. Yes, facilities has been doing some amazing work. The large conference room that's at the back of the building, they've been converting that over to my spaces for my department, so we'll have our first official home. I'm sure Kofa will be very happy to help us move out, and so that they have their space back, and we'll actually have 2 independent spaces, meaning Kofa has its own space again, and Department of Veteran Service will have its own space. And hopefully that will take place, that move will take place very soon.
Nice. Congratulations.
Yes, we're excited and looking forward to it.
Please don't.
Kofa's been our gracious host, but sometimes when you feel like you're that guest that overstayed their welcome.
Yeah, I have a son.
5 years is a bit.
I have a 22-year-old who's overstayed his welcome.
Okay. So 5 years, I'm doing good.
All right, that's awesome. Please keep us updated and let us know how all of that goes. I just experienced a pretty big move myself over at GIAC, and there's all the little things that you don't think of that pop up and end up being more time consuming than some of the big things. So, if you need stuff, let us know.
Most definitely. Appreciate that. Thank you.
All right. Any questions, other questions for JR? All right. I guess we will move over to some of the other departments and give them an opportunity to give some updates and share. We have Dr. Clark from the Human Rights Commission.
Well, good afternoon. And I have several updates to share with you. On August the 6th, we held our second annual Democracy Fest event, which was very successful. In fact, even better than the initial one last year, in my estimate. We moved the event from outside of Southside Community Center to the inside because of the threat of inclement weather, and had over 60 people attend the event. Was very lively, featured a small group of the Dorothy Cotton Jubilee singers, Sing Treese, who's a local and well-regarded performing artist, in her band, and had a number of speakers to address, the importance of celebrating democracy, the importance of civic engagement, and the need to be involved in our communities. And so that event went very well for us, and despite the weather. In response to several blatant public racist incidents, OHR authored a letter turning the tide on hate and racism and invited county leaders, including a number of us sitting here, as well as leaders from local human services, social justice, and nonprofit organizations. Over 100 individuals signed the letter, and there are even after the letter was published, there were other individuals who were asking that to add their names, even as recently as last week. And so we want to applaud everyone who signed on to this document and responded, with considerable speed to help to make this public statement about these unacceptable and blatant racist behaviors which have impacted members of our community, from not only adults but also children. And so that letter is, certainly, I think, an appropriate response to the issues that emerged and gave rise to it. And again, thanks for those of you who signed on to the letter as well. OHR and the Human Rights Commission had the opportunity to meet with Lieutenant Governor Antonio Delgado and his staff on August the 12th at the Borgwarner room of the library. OHR and the commission each presented an overview of our mission and work to the Lieutenant Governor. And we had a very good meeting with him to provide him a perspective on how human rights work has been operational at the county level, and had a very good interaction with him. I also, too, wanted to mention that in the departure of one of our staff members, Loris Cabrera, who worked with OHR as an information agent for the last several years. And her employment with the county ended on August the 16th. I very much appreciated her contributions to our staff and the county, and wish her well in her new endeavors. Finally, I wanted to mention that OHR has an upcoming program on September the 16th at 6:30 p.m. It will be a Zoom event, which is called An Analysis of the Migration Process, Current Immigration Policy. This was a program originally scheduled for June, but because of some complications, which included illness of one of the speakers, we weren't able to host it at that time. So this is the rescheduled event, which will take place, and our two speakers who will address this topic are Crystal Osmond of Miller Mayer and Jacqueline Kelly Widmer of Cornell Law School. And this is the second of three programs that are focused on migration, racism, and dispossession, which have been funded by a Cornell grant awarded to OHR. So that's some of what's been going on for us.
Thank you. Is there any questions for Dr. Clark? All right, thank you, Dr. Clark. We're going to go to Frank Rupa in Whole Health.
Good afternoon, everyone. Just by way of updates, we continue through the large number of RFPs that we have to complete. The three for the programming that the Alcohol and Drug Council were performing closed last week, and so we have review committees in place and hope to be bringing forward recommended vendors at your next meeting. So we're moving forward with those three, and our sexually transmitted infections treatment provider vendor RFP is closing today as well. So we're going through that. We'll be going through that review process as we move forward. But just wanted you to know that those things are moving forward, and hopefully we'll be coming forward to you relatively soon for your review and approval.
Thank you. Is there any questions for Frank? Randy?
Hello, Frank. I expect a response to this. I sent you an email this morning regarding youth mental health, and I was contacted by some people at Cornell that are apparently going around to various schools, and there's a meeting in Newfield School tomorrow evening. I'm not really sure what it's about, but it's related to youth mental health and development. So the question I have is, I know that the county has mental health staffing in schools, and some schools may have a full-time person, some may have a part-time person. Newfield said they need 2 full-time people. I realize that's not realistic. But can you get back to us on how many mental health workers are actually in the schools, and what does it take financially to put mental health workers in schools? I realize you're not going to answer it now. I just wanted to say I requested that information. So.
Yep. Yeah, we're working on that and have it to you shortly, Randy. We actually are expanding as we speak as the new school year starts. I think in Ithaca City School District, there will be a couple of additional schools added. Our biggest challenge is finding therapists to fill those positions. So there is certainly a financial component to it because the positions are not self-sufficient, but our biggest challenge is finding therapists to fill vacancies. But we'll get you that information and know that we agree and would love to have more staff in the schools supporting the kids.
Frank, does it have to be a therapist, or is there other qualifications that would allow kids and family, because sometimes it's family related quite often, that is only a therapist that you can hire for that role?
Yeah, so that's a big question. There's a lot of different services that could be provided to children and families. For billing purposes, our individuals need to be licensed. So we're not the same as a social worker that the school district hires necessarily. They may have the same degrees, but the type of work that we do is different, right? We are actually providing therapy, talk therapy, supported by medical staff as well. So we are creating a satellite clinic in the schools to provide therapy to the students. So it's a bit different than just general support to family and children. So the short answer is yes, you could use a myriad of different types of people to support children and families, but for our clinic purposes and being able to bill, it requires us to have therapy.
Thank you.
Any other questions for Frank? Frank, enjoy the rest of your afternoon. Thank you.
Thank you.
All right, so we have minutes approval.
Kate just got on.
Oh, Kate just got on. Kate, would you like to give an update?
Sure. So we are getting ready for a budget just like everyone else. We also have hired our youth service specialist. He started with us at the end of July, and he's been doing really good. So we're getting ready to launch our inclusion and accessibility initiative, which he'll be in charge of, and just doing the stuff, getting ready for the budget. So.
All right, thank you. Any questions for Kate? No. All right, Kate, there's no questions. Thank you for your report and joining us this afternoon. All right, approval for the June 17th meeting minutes. Amanda, are you? Amanda's moving. Do we have a second? Susan seconds. Are those in favor of moving the minutes? Looks like it's unanimous. Are there any comments from committee members? No? All right. It looks like we're adjourned.
Thank you.
Thank you.
Absolutely.